Health in Hull, we're focused on improving the whole population's health and well-being. And we know that smoking is the single biggest, what we call modifiable risk factor. That if we are able to remove it from Hull's population, it would be the greatest leap forward we could do in improving Hull's health and well-being outcomes. 40 people die each month in Hull from smoking-related illness. That's unnecessary, and over time we've seen reductions in Hull's smoking rates, which is fantastic, but we need to go further and faster to remove that harm that's associated with smoking. I have a 14-year-old son, and my 14-year-old son will never legally be able to be sold cigarettes. So he wouldn't be criminalised through the act of buying cigarettes. The idea is that we make the sale of cigarettes to young people illegal. So I think this presents an opportunity for us in Hull to make a real step forward in improving the health of our population. So there are benefits to people that currently smoke who will have even more access to services. We have really good services in Hull right now, but the initial additional investment that we'll be receiving will enable us to go further with the support that we can offer our communities to stop smoking. The benefits will be for those individuals that firstly receive support in stopping smoking. There'll be benefits to those that don't ever start smoking because of the new policies, and there'll be benefits to those, the wider community, families and friends, because fewer people will be smoking, fewer people will experience the illnesses associated with smoking, more people will have money in their pockets, and all the health and social care services that are provided in Hull that currently provide treatment to people that experience illness associated with smoking. In years to come, we will see a reduction in demand for those services because of a reduction in smoking-related illness. So there are huge benefits to the whole community, first and foremost in health and well-being, but also to the services that we have in Hull that support our population.
Absolutely. So, I mean, it's good. It's been going in the right direction for a long time, so that's really positive. And in York, we're doing well in terms of the smoking prevalence is coming down to one of the lowest in the region. But what that doesn't show is that health inequality. There's pockets of different groups around, so people who are living in social housing, people who are working in routine and manual occupations, where the smoking prevalence is kind of 4 or 5 times that of the average. So I think anything that we can do to legislate to support that continued reduction in prevalence is a real positive thing. I think it's brilliant. I think it's really a fantastic move. I mean, there's only so much we can do locally, and sometimes we need that national legislation to support our agenda. If you think of the smoking ban in 2007, one of the biggest things that could have sort of changed smoking perceptions and smoking prevalence. So I think we've gone so far from 2007, and now this is the impetus to get us down there and get us to a smoke-free generation.
Well, it would be absolutely huge for the region. Humber and North Yorkshire has some varying smoking rates, but some areas with up to 1 in 5 of the population smoking. That really is dragging our region down in a lot of ways. It drags our economy down when you have people off work due to smoking-related illnesses. It drags our NHS down when it comes to being able to see people in a timely fashion. It affects social care. It will be a cause of fires. It will be a cause of littering. Really, the impacts of smoking are just endless. I think this is one of the biggest things we could really do for Humber and North Yorkshire. It makes me feel really positive. I mean, I'd speak here personally as a dad of 3 under the age of 14. I'm super glad that my girls and my boy won't ever be able to legally purchase a cigarette. I think that will be fantastic. I think they will grow up in a generation of people who don't have to live with those health harms. And increasingly, as the generations go through, they don't have to live with the worry about their parents or grandparents or people that they love dying or getting an early disease through smoking. So it will absolutely transform children's life chances. It's something that's been done elsewhere. It's worked. It really reduces prevalence, and I think it's possibly one of the best things we could do for public health in the next 10 years. So really excited about it. Well, I think for a start, the whole community, our country needs to hear a resounding yes, particularly to this first proposal. And I think we're seeing that. If you look at some of the polls, the majority of people support this raising age of sale. And in fact, most smokers support this raising age of sale as well, because most smokers will tell you that they're sad that they started smoking, and if they had the chance again, they wouldn't have started.
I think in regards to mental health, an area where I work, it's heavily combined in the smoking rates. Smoking comes hand in hand in mental health, and I think there's an opportunity there again to improve the health of the city.
Have a look at the evidence as to, what impact that will have on our health system, on our social care system. Get it through. Let's get the support behind the Smokefree Generation. It's a huge opportunity. But don't forget, this is an addiction. It's something that people need to support. And as a public health team, we have services that are there to support that. There's passionate and really, really supportive people working in this area that care about the health and well-being of our residents.